CAPKR stands for Center for Applied Pharmacokinetic Research, and this is one of the long-running consortia that started in 1996. And the idea is basically focusing on pre-competitive research between pharmaceutical companies in areas that concerns all of them.
CAPKR is the leading center for physiologically based pharmacokinetic modeling, and over the recent years we have demonstrated the application of this translational tool to a number of diverse clinical scenarios and patient populations.
The CAPKR's unique setup allows us that we generate the information from sets of different tissues, cell lines, and so on at the one end. And at the other end, we have got access to clinical data to look at, how these translational models that we are using, taking those information from the biological, let's say, cell lines and whatever experiment that's done in the lab, how that actually performs when we are putting them into these models. In CAPKR, we both have got expertise in running these in vitro studies, doing the models, as well as linking them with clinical studies.
Within CAPKR, we do a number of diverse projects, but they all fall under certain umbrellas or certain themes. We do detailed in vitro characterization of metabolic enzymes and transporters, and that's also coupled by proteomic characterization of these proteins. And all this helps us to develop mechanistic organ models, for example, for brain, for kidney, that helps us to develop realistic virtual individuals within the physiologically based pharmacokinetic modeling framework.
And hence we have got good relation in the form of MOUs with, for instance, US FDA, as well as links with MHRA, as well as EMA and Japanese regulatory PMDA.
At the moment, our ongoing research is focusing on novel tools, the use of endogenous and imaging biomarkers, and also liquid biopsy to evaluate and investigate real-world scenarios and untested clinical situations, all with the aim to support model-informed drug development in this area.
To become a member of CAPKR, the pharmaceutical companies have to pay an annual fee that goes towards the kind of research that all the members together decide on its direction. And that is basically voted annually on the basis of the areas that concerning majority of them. Currently, we have got 10 of the top, based on R&D expenditure, top pharmaceutical companies that they are supporting all our activities. But over the course of the more than 25 years of CAPKR, we had many members who have come and be part of CAPKR activities. Initiative that recently started in the University of Manchester is called UK CERSI, for Center of Excellence in Regulatory Science and Innovation. Our involvement in that center brings up many of the challenges that people are seeing for the modeling and simulation to open, and with the discussion that between all the experts happen, we increase the reliability of these models, acceptance becoming wider, and therefore people get appreciation that they are actually addressing many of the gaps that the real clinical trials that they cannot address.